My name is Gayathri Badrinath. I'm the founder and CEO of a virtual company called Devyn. We are focused on making it easier for women to get ahead of their heart health earlier.
Hi, and I'm Courtney Jordan Beckler. I'm a preventative cardiologist in Minneapolis at the Minneapolis Heart Institute. I also serve to direct our health equity and health promotion. I'm really excited about opportunities like Devyn that help really flip this around and put the human being in control of their prevention. Our heart health really starts at birth and goes until death. And so, as opposed to these kind of episodic diseases, sometimes we forget about the importance of keeping our heart healthy long term. When things are going well, you're not really aware of this little pump. It's about the size of your fist, whose role, our heart's role, is to really circulate that blood throughout our entire body, providing nutrients and really the energy to our muscles. So sometimes it gets forgotten, and we don't think about it until there's a crisis. Great opportunity today to talk about all the efforts and attention it deserves from a preventative standpoint.
Right. And so it's a new year. We're getting a lot of resolution type marketing at the moment. And a lot of that has to do with weight loss. I know a lot of women see their Instagram ads and it's a lot of weight loss on there. Maybe that's just me. But is there a link between heart health and weight loss?
I'm so glad that you said that, because there's often this misunderstanding that heart health is only about weight loss or equivocal to being a healthy weight. And really, as we've learned through science, we know that the type of fat matters a lot more. So sometimes we will even talk about the difference between subcutaneous fat, which is really just the fat around our skin, versus visceral fat, or the fat that's actually on our organ. That's the fat that we're really worried about. And there's all sorts of new testing. There's new ways that we can look at the impact that our weight is or isn't having on our actual organ. So there's a lot more advanced testing and earlier diagnosis that we can do with the heart, even without weight loss, to make sure that we have the best prevention set up long term.
Right, and that's why you see sometimes people quite thin, but then can have a heart attack. And you don't expect that. You think that if they're thin, they're healthy, but that's not the case.
Absolutely. Yep. Sometimes we call that skinny fat, right? And so sometimes, but even that's probably this over obsession around simply weight and not having more understanding about the actual health of your body and the organs, and in this place, your heart and cardiovascular system.
So, Gayathri, how can women stay ahead of their heart health when they're thinking about day to day, but also long term?
Yeah, thank you for asking, Peyton. Just to kind of give you a background, before starting Devyn, I spent about 20 years in the cardiovascular space. And, our goal is that women can be proactive about their heart health. What we know from data oftentimes is in the primary care arena that typically the conversations will start to flow first with weight with your physician, and then followed by breast health, and then followed by heart health. And the question is, can we shift those conversations to really a heart first approach? Because 9 out of 10 women have one or more risk factors for heart disease. You might be familiar with the traditional ones, such as blood pressure and cholesterol, but women also have unique risk factors, such as conditions that they had in pregnancy, which are really important opportunities for conversations. One key element of heart health is know what your blood pressure is and know what your cholesterol numbers are at every age. In women, a blood pressure of 120/80 is considered normal, and a total cholesterol below 200 is considered normal. If your blood pressure or cholesterol numbers are higher than these ranges, ask your doctor specifically what you can do to lower these numbers. And it's really important, having spent about 20 years in this industry, there are so many treatment options in the cardiovascular space. It's a very unique space that's well developed, and there's lifestyle, there's medications, there's a lot of advanced testing and procedures. This is why we really feel that this is the right time to get ahead of heart health. One interesting point for women is data shows that women with high cholesterol are more often to be told to change their diet and exercise versus men with similar cholesterol profiles are offered medications. And while it might be intuitively attractive to not take a medication, it's really important to understand what your individual risk profile is and the expected benefits of each treatment option so you can stay ahead of any heart health issues. And just as an example, lifestyle changes in blood pressure are often associated or typically associated with like a 3 to 5 point reduction in your blood pressure, whereas some drugs can offer you up to 20-point reduction, right? Your personal response may be within these ranges or much higher or lower, but it's really important to have discussions about these particular, what is my risk profile and what are the specific treatment options that are available for me.
Right. That's so interesting that you say that about men being offered medication and women being asked to make lifestyle changes, because we see the same thing with difficulty orgasming. With men, or if there's erectile dysfunction, medication is often first-line defense. Whereas with women, if you're suffering from vaginal dryness, what's mentally going on? Like, what have you seen a therapist? All of those things, and there hasn't been strides in that way for women. Okay, so Dr. Courtney, what's so unique about women's hearts? Why are we talking specifically about women's hearts, not hearts in general?
Yeah, well, one of the reasons that we're talking about women's hearts is, unfortunately, as you just mentioned, we lag behind men in terms of our clinical outcomes, in terms of our participation in research, in terms of getting diagnosed early, in terms of actually getting the medications and interventions that are those that we offer to our male counterparts. And one of the first times that we see this sort of increased risk start happening for women is during pregnancy. So certain complications can arise during pregnancy. You can get high blood pressure during pregnancy or gestational hypertension. You can get high blood sugar or gestational diabetes. You can get preeclampsia and eclampsia, combinations of high blood pressure and other organ issues that can happen during pregnancy that all increase your risk of then developing cardiovascular disease somewhere between 50 and 300%, depending on the individual situation. And a lot of women don't know this. They don't, we just looked at our own data this summer, and we saw up to 60% of women don't fully have that risk reduced after that initial pregnancy. And then if it happens again in subsequent pregnancies, it can be even higher of ultimately increasing their risk of developing heart disease. We also know that women between age 35 and 45 are one of the fastest growing areas of heart attacks that we're seeing. And so in many other places, we're seeing those risks go down, but we're seeing that particular area or that age demographic increasing. So something that we really need to look at risk factors. We also know early menopause, so going through menopause before age 40 also substantially increase your risk of developing heart disease early. So we want to be aware of that. And then finally, PCOS, or polycystic ovarian syndrome, is another category that increases your risk of developing heart disease. So we need to think about women in this critical time period during these reproductive years to be having fully informative conversations to make sure that we see these outcomes equal and ideally even better, right, for women long term. The exciting thing, as Gayathri was saying, there's so much opportunity for prevention. So up to 85% of heart disease can be prevented. Sometimes I think that women feel a lot of shame around that number, and that if it somehow happens, they didn't do something right. And I think the whole point of having these types of conversations and bidirectional information is for you to be able to have a conversation with your clinician, with your family, whatever the case might be, to figure out what the best path of prevention forward is for you. Is that medications? Is that lifestyle? Is that ideally a combination of the two to get your best bang out of what's possible?
Right. So if you're a woman, you're watching this, you're seeing it, and you go, "Oh my gosh, what are some questions that I should ask?"
That's a really good question. So I think talking to your clinician about, hey, I had these issues come up in pregnancy. As Gayathri said, my blood pressure still isn't to that goal, 120/80, would be something to talk about. Understand your cholesterol numbers. We want to see at least that total below 200. And then we want to see the LDL, depending on your risk profile, again, at a minimum under 130. But if you had some of these complications come up in your pregnancy, we may want to see it even lower. And that would be, again, a place to have a conversation with your clinician about, should I consider a medication to get some additional lowering of that? Or what can I do from a lifestyle perspective that might make a difference in that? There's advanced testing that we can do now with different blood markers looking at inflammation, which we see more commonly in women than men also. That's going to have a difference in your overall outcome and likelihood of developing heart disease later. So I think having that conversation to start and figure out how best you want to minimize that risk of developing early heart disease is a critical one.
So we've spoken about how women's hearts, they're not necessarily different as an organ, but it's contributing factors around it. Is that correct, would you say?
Yeah, I think that's fairly correct. What we know is that genetically we're about 99% the same, men and women. There are some differences in terms of micro or small circulation. So we see some differences cardiovascular wise there. The role that hormones plays is also very critical. We know that, again, part of our risk increases substantially when we don't have as much estrogen available, and that's different for women during different periods in life. But I would emphasize what you're saying, Peyton, that I think the multiple roles that we have in society is a big piece of this, as often, women helping be the primary person in families, raising children, sandwich generation, if you're taking care of older adults, women in the workforce, all sorts of competing factors that ultimately we tend to prioritize our health last. And unfortunately, sometimes we get that treatment on the clinical side as well. So the need to really change these modifiable risk factors is critical.
Right. And is the same true for different ethnicity or racial groups? Right.
Yeah, unfortunately, when we look at heart disease outcomes, when we look first by gender at birth, women do worse than men. And then when we look from a racial and ethnic perspective, women of color, unfortunately, have the worst outcomes as it relates to, again, getting early treatment, disease detection, getting put on the right medications, having blood pressure, cholesterol, blood sugar at goal, and then ultimately being more likely to do worse as it relates to death and morbidity overall.
Right. Gayathri, you've been working with OBGYNs across the country to raise awareness about heart health. Why OBGYNs?
Great question, Peyton. Well, first of all, OBGYNs, a lot of women use their OB as their primary care physician. People, especially at a younger age, our goal is to get women earlier, right? Earlier. How do we start these conversations, shift the discussion away from weight to a heart first approach, long before they see or need a cardiologist? So we're collaborating with the OB community, letting them know to provide easy virtual first access to women who qualify and need treatment to stay ahead of their heart health. For example, we know OBs see women with high blood pressure, certainly when they're pregnant, but then after they're pregnant, where are these women, are they going to get treatment? Our goal is, the data is quite interesting. We could prevent millions of cases of heart disease if we can focus on these women with what we call adverse pregnancy outcomes, so gestational diabetes, preeclampsia. Just ask the question, did you have this? And then focus with them. And again, a heart first approach that isn't just solely focused on weight. How do we reduce the risk? So women can also sign up directly on our website. And, at Devyn Health, you can see a listing of some of these conditions and sign up for our early access program. Mm-hmm.
And what does that include? Just so I'm aware, the early access.
So when we start launching our clinical services, our goal is that you can see a qualified professional that understands cardiovascular prevention, a licensed clinical professional, be able to have that conversation, and then determine what the right interventions are for you, ranging from medical interventions to, to lifestyle modification.
And what do you wish that younger women knew now before they get into all of the health? They start talking about blood pressure before they're even thinking about that. What do you wish women knew?
I think first and foremost is that you can have a larger frame and still be very healthy. We are so focused on weight and, how do we look and be skinny? Just as a society, let's just take a fundamentally different approach to our health, focus on our heart health. Because when we stick with the science, there are many facets here that we can leverage and help women get a complete picture of their health. And, our whole goal is, how do we get you to heart health that lasts a lifetime?
Right.